The University of Maryland medical system consists of hospitals that are dispersed throughout the state. They include urban, rural, and suburban hospitals.
The culture at University of Maryland Medical System is physician-friendly.
In all of my training in medicine, I didn't realize that you could actually have a career like this. And it's been a lot of fun and very busy and very rewarding.
The thing I hear most from newly hired physicians is not only the variety of practice settings that we have to offer them, but also the strength of the university system that's behind them.
This institution has a lot of particular strengths that are not available sometimes in the community. Oncology is certainly one of those strengths. Transplantation, trauma, infectious disease here. We probably have the largest group of infectious disease physicians in the world, I would submit. We also have strength in genetics and genomics. We have strength in primary care. So it's a very broad-based institution, and physicians working in affiliated institutions have access to that. The institution has a broad and profound culture of teaching, education, caring for patients, and research. This is a very exciting environment. It is a unique situation to have a hub that is an academic medical center with a lot of excitement and change going on.
Good morning, Mr. Thomas. How are you doing this morning? I chose to work at Maryland General Hospital for the biggest reason. I was interested in a hospital that was related to a university and also had medical training staff. I just wanted to go over a CBC and BMP. I think being part of the University of Maryland medical system and the different area hospitals that we have relationships with are certainly a plus.
We need to get a daily weight on the patient.
Maryland General Hospital is a good facility with regards to someone who's right out of medical school. It's a nice community hospital. You have some seasoned physicians that can really help you or transition you from being a new graduate. We serve a varied population, and I think it's nice with our culture. It's somewhat more laid back type of atmosphere. As a whole, University of Maryland and their medical system is very, very good as far as their leadership, very approachable, and particularly at Maryland General Hospital. The administrative staff is very approachable. They certainly listen to the physicians.
Do you know where he's going for his rehabilitation? I chose to practice at Kernan Hospital. It's an all-orthopedic specialty hospital, so it offers all those advantages of the operating room and the surgical suites that allow us to really focus and specialize with our team in performing orthopedic procedures. Kernan has all the technological aspects of a major medical center, but with the convenience and the collegiality of working with a smaller team in almost a community-like setting. I've worked at a lot of bigger medical centers, and you kind of can get lost in the shuffle or have access to resources, but always have the backup of the major medical center if I need that as well, since it's part of the University of Maryland medical system. We have a large resident staff there. Our whole orthopedic team does approximately 60–70% of their rotations there, and the staff there that works with them. Great place to train. Educational facilities are top-notch. With that kind of large educational atmosphere, it's a great place to work.
Practicing on the Eastern Shore is actually, I think, similar to practicing at many places in terms of how busy we are. The things that make the shore unique are probably the people and the culture. One thing that I've been surprised about is the amazing amount of services that are offered in this hospital.
How are you feeling?
The most amazing thing that I've experienced since I've been at Memorial Hospital has been the openness of the administration to allowing people who are innovative or entrepreneurial really develop a program along the lines of their ideas. I've seen the initiation of a Jocelyn Center. We've had a wound center with hyperbaric medicine for quite some time. We've been able to start the first remote pre-transplant evaluation center outside of the main hospital for the University of Maryland. For people that are looking for a slightly slower pace of life, working with groups of people that are very appreciative of care, and looking for a small community where you can know everybody, this would be an ideal place to live and work.
Good morning. I'm Dr. Mateo. Dorchester General Hospital is a very small hospital. It's a community hospital. So we're going to continue the treatment. For being a small hospital in a small community, we do have the advantage of having pretty much every single specialist. We have many internists taking care of their own patients in the community, which is actually unique.
I wanted to find out on this patient.
We are a system. So our physicians from a very close community, which is Easton, can go from one hospital to another. So that is really an advantage. And you will not find that in other places. Are we having a busy day today? We have radiological images, everything from MRI, CT scans, angiograms, every single specialty is present in this hospital.
So you never had a heart attack before?
If you are considering to start a new job or relocate, I think Dorchester General Hospital could be a very good choice.
We have different types of specialties of technologies available. We have different types of therapists and specialists. And there's a great emphasis by the administration and by the culture of the hospital to everyone work together, to everyone respect each other's contribution to the care of the patient.
How's the therapy going today?
Because of the relationship with the University of Maryland Medical School, you have the opportunity to combine research with clinical practice. And that's a unique opportunity for people who want to do mostly clinical work, but who still want to work in a research environment. Well, University Specialty Hospital is located in the Inner Harbor, which is the downtown of the city. For physicians considering to work at University Specialty Hospital, I would tell them to consider this place as a very exciting opportunity to practice medicine in a different setting than the acute care hospital, but at the same time caring for very sick patients with the goal of rehabilitating them and sending them back to the community at their baseline function.
Chester River Hospital Center is a very nice community hospital in rural Maryland, located on the Eastern Shore. There's a lot of golfing, hunting, fishing, sailing, boating. After having had a stroke last week, Chester River Hospital Center is a rural hospital, but we're fortunate that we do have state-of-the-art facilities in radiology and cardiology. Our cardiologists are becoming certified in the use of CAT scans to evaluate for coronary artery disease. And in addition, we have a hemodialysis center here, and we have surgeons that treat major vascular problems such as AAAs and dissections. If you like rural living, this is a good place to come. And it's a great place to raise a family if you are in that point of your life. And if you're further on in your life where maybe your family is already raised, it's a great place to slow down a little bit. Have you experienced this before? Chester River Hospital Center allows me to practice medicine the way I like to practice, and also allows me to live a lifestyle that I like to live as well. And it's been it is a great place to live and a great place to work.